GE brought to the table an ability, I think, to identify what our problems were, to choose the individuals who were in committee to formulate the best solution to those problems, and then to guide them into making those decisions, and then provided us with the leadership skills to be able to make the changes that we needed to make at the physician level. There were a lot of changes that needed to be made at the non-physician level, but no matter how well those changes were made, if the physicians didn't come in to do the surgery on time, didn't follow the rules that we'd set up for them, the plan wasn't going to work. And they provide us with the tools to be able to convince the physicians on what it was that we needed to do.
But I think GE's knowledge of teams, how teams should work, from how you conduct a meeting to how you control the conversations and direct them and so on and so forth, was very, very helpful in making those teams effective, and they became very effective. And I felt that the GE guys were right there by our side with some other physician leaders who were willing to challenge their colleagues.
To assemble our team and to determine who was going to participate in it, what we did was started with our OR committee that was already established. The CEO was very involved in and instrumental in giving us the resources that we needed. So we met with GE and they suggested people that should be on the teams to help us. We had a number of sub-teams. We had our OR committee that was mostly physicians on it. And then we also created 3 sub-teams. And each team had between probably 8 to 15 people per team.
After GE looked at our data that they requested was in our pre-admit testing area. Actually, preparation of the patients prior to surgery was identified as a hindrance to our OR schedule, as well as our OR schedule in and of itself was not being driven by anything. It was just kind of happening. And then what we were doing during the day to troubleshoot those problems that were occurring and how were we handling it was probably not as most efficient way to do it. So there were some solutions that came out of those teams, as well as there was a third team that addressed actually the staff in the room and the tasks that everyone was doing to complete to get the OR schedule moving, and what solutions could be brought up that would be an improvement in what our process was.
We had several different people involved in each of the teams. It was a wide variety, so it wasn't just a nurse. It was anybody that was involved. We had housekeepers involved, especially with like turnaround rooms. So we used a lot of the resources and the additional ancillary services that were involved in each of the process, so we can get them on board so they can share the vision. And each team did have physicians that we recruited to help lead the team and to give input on it.
We used the data to make decisions on what we were going to do. We would meet, we would integrate whatever information we had, make decisions on how we were going to make changes, and then we'd formulate the plan that we'd use and then go through the governance process to try to get them going.